announced St. Louis County's first death. No one could have imagined the incredible toll this pandemic would take on our region and on our country. More than 520,000 people in the U.S. have lost their lives to this pandemic. In St. Louis County, 2019 lives have been taken by a virus few of us were familiar with a year ago. But before I get too far in my remarks, let's go back to that first death. Judy Wilson Griffin was a perinatal nurse at St. Mary's Hospital. It was her passion to help mothers bringing their babies safely into the world. In a statement, the hospital said Judy was an incredible nurse, educator, leader, and person. Her passion and dedication was second to none, and she was a hero in the truest sense. I take this moment to remember Judy and the others' lives lost. The remarks I made on that Friday evening, March 20th, in announcing Judy's death bears repeating today. As days turn into weeks, the coronavirus will affect us all, and each of us must realize that we are truly in this together. It's compassion for each other that will get us through this, and although we must be socially distant, we must come together spiritually. We are bound one to another. We are one community, and as one community we will find hope. As one community we will overcome this challenge. And today there's hope. After seeing more than 800 cases per day in November, we are now averaging 125 new cases a day. A year ago, a vaccine was not available. And today there are 3 FDA-approved makers of this life-saving shot, and President Biden said that the distribution stream is robust enough now that every adult who wants to be vaccinated could be by the end of May. In St. Louis County, we are holding large-scale vaccination events and have set up regular vaccine sites, and we have mobile sites to get to many of our vulnerable residents. We know there remains frustration. Many people are eligible for a shot, but not able to get access to one based on a limited supply. I share that concern, but we are seeing the number of doses increase substantially, allowing us to get more shots in arms. We are encouraging registration at multiple sites, and the state, county, and hospital systems are making appointments based on those who have signed up and their registries and those who are eligible. We have been able to slow the combination and a decline of COVID cases and an increase in vaccinations. Beginning today, 5 more changes will be made to our public health protocols, allowing for more ability to get out and about safely. First, all businesses can now remain open until midnight. Previously, the curfew was 11 p.m. Carry-out and delivery is not affected by this curfew. I want to thank our restaurant advisory group for continuing to work with the health department to make good recommendations at the right time. Gatherings, which have been limited to 10 people, are now 20 people maximum for indoors and 30 for outdoor gatherings. This includes birthday parties, reunions, and barbecues. With these gatherings, our public health experts recommend that people from not more than 3 households gather at either indoor or outdoor private residential events. Indoor banquet facilities and conference centers can now operate at up to 25% of capacity, with the same health and safety protocols of restaurants, including spacing of tables and guests wearing masks when not seated. Prior to this change, the capacity was limited to 50 people, regardless of capacity. Capacity for outdoor events and outdoor facilities will be 50% as long as social distancing requirements can be maintained. Such events must comply with the Department of Public Health's planning event guidelines. An outdoor event that is larger than 500 people, based on the 50% capacity, should have the plan approved by the health department. The department may ask to review plans for every event under 500 if there are concerns that safety restrictions are not being followed. The health department is happy to work with you to ensure your event can move forward safely. And finally, all sporting venues which are locations where sporting events are played with spectator seating can now submit a plan to the Department of Public Health. A plan must be approved before any venue can hold an event or engage in daily operations. Most venues were previously held to a spectator rule of 2 people per player. All entertainment venues, which include casinos, theme parks, and museums, must continue to submit a plan for approval by the Department of Public Health. Restaurant and bar capacity remains at 50%. cautious opening of St. Louis County is made possible because so many of our residents have worn masks, limited gatherings, and stayed home as much as possible and respected the space of others. The more we continue to do that, the safer we can be. As I said a year ago, one community, we will find hope. As one community, we will overcome this challenge. Thank you, and I'd be glad to answer any questions.
We have a couple of questions from St. Louis Public Radio. What are some of the specific initiatives you want to work on with the next mayor of St. Louis?
Yeah, so the question is about regional cooperation with the next mayor of the city of St. Louis. First of all, we'll continue to work together on public health as we have with our COVID response, which has been coordinated with all of the health departments in our region, not only with COVID testing, but with the vaccination rollout. And we'll continue to do that, and that will blend into other issues of public health, such as access for those who have difficulty finding access to our safety net hospitals. We'll continue to work together on economic development. We have a lot of work to do to grow our economy, to bring jobs into our community. Workforce development is important. We'll be working with the state and regionally to help address the needs in a changing and evolving economy, to make sure that folks are prepared, that we have workforce development programs, education and training available for those high-need job opportunities. And we'll continue to work together on public safety. We saw over the past few months success that we can have with a limited pilot project in North County and North City with intense, high-level daily communication between St. Louis County Police Department and the St. Louis City Police Department, and that was had a real and significant impact on violent crime in those high-resource areas. And we'll continue our coordination, communication, and cooperation on public safety.
A follow-up from Public Radio. Do you think the increased hostility on the County Council toward your administration will make forging city-county collaboration more difficult?
Yeah, so what we've seen, the question is about the relationship between the County Council and the County Executive's Office and my administration. And we know that relationship was strained a great deal over questions about our public safety protocols, about our response to the pandemic, about some very difficult decisions that we made here in St. Louis County to protect the health and welfare of everyone. And there was a difference of opinion on the County Council and my office on what the proper path forward there is. But as we continue to ease those restrictions, we continue to move out of this pandemic, I believe that we'll continue to work together on the areas of agreement in St. Louis County. And that's economic development, infrastructure, roads, public safety, and we'll see. We'll see moving forward if this remains one of those historic times where the County Council, as it has from time to time, and other municipal city councils have as well, becomes confrontation opportunities, or if we work together to solve problems. I think the expectation of people in St. Louis County is that we'll work together to solve the real and significant problems that we have in our community.
That's all I have.
Okay, thank you.